One of the approaches in this particular training program that I think is extraordinarily valuable is that it acknowledges that dementia, Alzheimer's disease, and the related disorders are not a single thing, that people really do evolve, and their needs and the approach that one has to employ really evolves with time. And so not being a static thing, I mean, what do we need to do and how do we learn to identify the stage of illness that people are at, and then the actual approaches that one uses based on the stage of illness. So in each of the components there's an acknowledgement of the stage of the illness and how that influences what we do in providing care.
I watched the client's progression of the disease over a period of about 6 months. And at first she was very mildly confused and kind of pleasant to be around, and she was easy to manage. You could suggest something and she would just go do it. It was pretty simple. And then over time she got a little more hostile, a lot of anger directed at her disease. I think that she was very frustrated with what was going on in her mind. She would stomp her feet and bang her hands on the table and even throw things down on the floor and get really angry. And it's hard to watch. You really feel for them, but I think the training helped, knowing that this wasn't something she wasn't mad at me, and I never took it personally. It was just her frustration level with what was going on in her mind that she couldn't handle.